Welcome everyone to Pet's Best Friend with my good friend Dr. Anaya Kathio. Remember folks, 24/7 you could look up on our website and learn all about what Dr. Kathio talks about, or Google him and you'll see all the shows we've done. Dr. Kathio has been around since 1975. He is an international veterinarian, travels all over the world and does a lot of good. It's nice to see you again, my good friend.
Thank you very much, Sam. It's been a while since we did our show, but we are back again.
You just come back from Pakistan again?
Yeah, I was on the diplomatic mission, and
that's interesting.
U.S.-Pakistan relations. Beside veterinary medicine, I do good for international community as well.
Now you also have some hospitals there, right?
7 veterinary hospitals in Pakistan.
Now the interesting thing is, and I keep asking this, is you fund that all yourself?
All by myself, yes.
And you do a lot because as we did a show on the animals, it's a lot different having animals here because they use their animals.
Yeah, I'll bring some of the videos next show.
I'd love to do that.
About the elephant and tigers and all those things. Yes.
Yeah. Staying here in the United States, okay, and the reputation you've gained. Before we get into this, we have some great things here to show you today, folks. But general care for animals. Sometimes people. They try to take a shortcut, and with the economy the way it is today, doctor, you can understand. Well, we don't have to do this for our pet. But then when something seriously happens to the pet because they didn't take care of him, then it's like a catch-22. What are some of the things people should be looking at with their pets? Just on a yearly basis.
Sam, just like you and I, we wake up, take a bath, and go to sleep, take a bath, and stuff like this. Grooming care is very much important in animals. Starting from the nails. If we have long hair animals, you make sure they get combed. Because I had an animal yesterday. People did not take care of their nails. Actually, the nails were buried into the flesh. They turned around and went back into the flesh. Again, sometimes the neglect, is overwhelming too. How can you not notice an animal limping and the nail is gone down into it? The ear cleaning, routinely you clean your dog's ear like twice a week or something, especially dogs with the floppy ears, because they tend to develop infection. And young animals with the parasite controls, like intestinal parasites, it's a common problem in young animals. It can be communicated to human beings, especially the toddlers. And summer season is coming, and heartworms, the mosquito will be out. Make sure your animal is on preventative medication so they do not get the heartworm. In fact, on our show, I will show you a dog that is infested with heartworms. Actually, these are the long worms. They live inside the heart of the animal, and they are transmitted. A small little filaria is transmitted through the mosquito bite to the animals. There are many things I could talk about and show.
Well, I'm saying in general, the best thing, of course, is you have a pet. I remember from many shows we've done, you saying, well, you're buying a pet. It's not a piece of furniture.
Exactly.
Okay, when you buy the animal, make sure before you buy the animal, you know what that animal requires. So if we have a Bichon, we know we have to do with our Bichon. If you have a Lab, or if you have a Bulldog, or if you have whatever, different dogs require certain things. You should know about them before you really purchase.
Their nutrition. You have to know about nutrition, their immunization. Again, I had another cat yesterday in my office, and she had a leukemia, and that feline leukemia could have been prevented by introducing immunization to the animals. And these tiny things, matter a lot.
What we're going to show you today, folks, are some of the things that the doctor encounters, and basically is the preventative thing is the most important thing. We have a dog now with a paralysis, okay? Yeah. So, Andy, if you want to run it, the doctor will explain what exactly we're looking at. There's the dog there.
Yeah, this is the dog. You can look, right side of the lip is sagging and the dog is drooling and has developed a paralysis. It's called facial paralysis. Similar thing happens in human beings. They call it a Bell's palsy. And can it be treated? Sometimes the people get panicked. My dog has a facial paralysis and they get so much upset. Remain calm, these things can be fixed, and what causes this paralysis? Sometimes the condition is unknown, or in dogs, most of the time there's an infection in the middle ear or infection in the ear area. It spreads to the nearby nerves, and it causes the inflammation of the nerves, and the dogs, they develop paralysis. As I said, make sure you keep your dog's ear clean or something like that one. And I treated the dog for a few weeks, and the dog, as you saw, went back to the normal self.
So here again, could that have been prevented?
Yeah, if it can be prevented. A floppy ear dog with the ear infection extended a little bit further, involved some other facial nerves, and got paralysis. But thank God, we were able to reverse it.
All right, now we have a parakeet, okay? And what's the story with this parakeet?
Yeah, people bring some animals keep them as a pets. And these pets get sick, and you can see this parakeet and looks very inactive, and it seems to be in a pain and is depressed. Something is going on with the parakeet, and you can see the parakeet been pushing and pushing, and that vent, the red one you saw, came out, and we did a radiograph, and on looking at the radiograph, that parakeet had egg is stuck in the vent area, and I was able to surgically remove that egg, and you can see the vent has gone back into the normal position, and it's not prolapse or anything. This was done with the surgery, with the laser surgery, and now you can see the difference.
This happy little parakeet.
He's a little parakeet or something like that. And by looking at it, you would see, a common person will see that, oh my God, the intestines are coming out or something, and they get panic and they think he won't live. But if you take him to veterinarian, and we have developed so many procedures, and we have so many treatments now, we are able to save many lives compared to 50 years ago.
I've witnessed a number of them in your office. I guess the classic was when that emergency came in with that guy with the truck, and the dog came in with the severed leg, and I saw you in action, and I'll tell you what, I was like devastated, and you just was as calm as can be, and you took that animal, and you had everyone, ultra professional, and knowing exactly what to do to save that dog's life. And I saw that dog after, it has one leg, you had to take the leg off, but was as happy as can be, and the owner was, it was
already taken off.
Oh, that's right, it was taken off, that's right. And I remember how, how just, I would have been like, me, I'm a big baby when it comes to stuff like that, but you were fabulous. Folks, I'm talking to Dr. Anaya Kathio. His phone number is 655-2412, okay, it's 655-2412, or in Wilkes-Barre, 821-9392. You have any questions at all, please give him a call. I know he's busy, but however, he's always, 99% of the time, he answers the phone himself. Why he does that, I don't know, but he's there at nighttime, taking care of pets. He'll sleep with the dogs and the cats and make sure they're okay. He's really dedicated to his profession. We'll be back right after this. Hi everyone, Sam Lesante. Welcome to Pet's Best Friend with my good friend Dr. Anaya Kathio. Folks, remember 24/7, this information is available to anyone, and anyone in the United States and the world could watch the show, learning about care of animals. If you have an animal, folks, pets particularly, you know what you have to do. It's well worth the investment to take care of those animals, take them to your veterinarians for their shots, as the good doctor says. You've seen so many cases that it's just like human beings. If they don't take care of themselves, it's the preventative medicine, then sometimes you can resolve the problem, but it takes a longer time, and sometimes it's too late to take care of them. So taking care of animals is extremely important. In your profession, all right, I mentioned here you're going on 30 years, and they brought you here from Pakistan, and you travel all over the world. You went into Italy, you went into France, and a number Dubai, and to teach people veterinary medicine. Okay, what do you continuously? Are you schooled continuously? In the new technologies. I know it's a stupid question, but I want people to know that veterinarians, particularly you stay ahead of the bar here.
Yes. We do have something called continuing education. I get most of the continuing education in Cornell University, New York. and any new technology comes in, and I take that technology and take him down to the world and tell them that that's what America is. We do research, we work hard, we are kind enough, to give you all this technology so you can improve your quality of the practice and save the life of animals, as well as cut down on the economic losses as well. Because in developing countries, the livestock and poultry, it is very much important, and especially in Pakistan, I have cut down the economical losses by introducing the diagnostic procedures in infectious diseases and certain diseases that can be prevented, and that is helping the economy as well. So veterinarians are not only limited to like dogs and cats, but for the agriculture industry, livestock industry, they are the backbone for that. Pakistan's economy's 4% GDP is the livestock.
Oh, wow.
Yes.
It's very important. Two offices he has, folks. One in Wilkes-Barre and one in Pittston. 655-2412 is the one number, and 821-9392. I put you those numbers in because we get a lot of calls when the show goes on. You could also go to his website, Kathio, Kathio.com. But feel free to call here for his phone number anytime, but we want to make sure the number's up there. Now, we're showing some animals that you're taking care of. Now we have a abscess tooth here, I guess, on a dog. Okay, so and if you want to run that, and doctor will tell us, here's a...
you can see the swelling on the face, and that swelling on the face is inflammation, which is caused by the bad teeth. And dog's teeth should be cleaned every 6 months. And if the teeth are not cleaned and the bacteria enters into the gums and into the teeth, and they develop infection, and sometimes the infection travels quite a few distance, and it can affect the eye. And normally the dogs come to us, we'll see the eye is closed, and there's a swelling on the upper part of the lip. And we lift the lip up and we find out that the dog is having abscess. And once they develop an abscess, sometime a very important tooth, a carnassial tooth or a premolar, fourth premolar, that has to be removed to relieve the pressure and get rid of the pus or something. So as I said that in the beginning, that dental care in the dog is equally important. Dogs and cats should have a dental cleaning every 6 months.
And that's imperative because this is what happens. Now, you also is not taking care of the dog's teeth. Can lead to kidney problems.
Kidney problem, it can lead to, see, you become a doctor now.
Yeah, thanks to you.
Become a kidney problem, heart problems, lungs problem, because the tooth that is bad, that is located in the very high blood supply area, which is a gum, and bacteria enter into the blood supply through the gum blood vessels, and when the blood circulates, so they accumulate in the heart valves, causing a myocarditis, or they go into the kidney, cause a renal failure, or pyloric abscesses there, or when they filter through the lungs or the liver, they cause the liver and lung infection as well.
Just like human beings, they say if you floss your teeth every day, statistics show that you'll get an extra 2 years, or give you an extra 2 years of life.
Yes.
Okay. Now we have a dog who had a fractured bone. So Andy, you want to run that one there, and the good doctor would tell us what we're looking at right now.
Yeah, the dogs, and especially the puppies, they run and jump around. You can look at that when there's a fracture in the long bone. I repaired that when there's screws and plates, and when the animal is younger, the recovery is fast. And you can see here he is. You can the younger animal have a great recovery. If there is a fracture,
walking around pretty good.
Yeah, he's walking around pretty good because I am a good doctor. and I did
So he
this
broke
open
he
reduction.
had a fracture on the leg, right?
Fracture on the tibial bone, which is a long bone in the hind leg. You can see there's a big fracture, and that one we have to reduce it, open reduction, put some plates and screws together, and it can be fixed. And there are other ways of fixing the bones. If you do not have too much money or something, you can cast them, and it will also makes union of the bone.
Making an investment in your animals, in your pets, is very important. And sometimes, you know, I know that you have been extremely fair. I sometimes, I guess, when someone comes and they get what the charges are, not realizing that, you know, you have an office and you have the latest equipment, etc. But basically, when you look at, you know, what your fees are, I think they're extremely reasonable.
The veterinarians, we are a business, and just like other businesses, all the veterinarians have a huge overhead. We have a payroll, we have insurances, we have utilities, and we have to buy supplies, and we have a medical waste that has to be disposed a special way. There are lots of things that people don't think that a veterinarian, is spending money which they cannot see it, and they complain that the veterinarians are expensive. You saw that the fracture that I repaired in a puppy, that requires the same type of knowledge as a human orthopedic doctor does. It requires the same type of techniques that human orthopedic doctor will do. And if that was a human, he will get, I think, 30 to 40 times much more money than we veterinarians we get it from the animals.
Folks, when we come back, we're going to show you a heartworm, okay, an animal, and also animal had ear, nose, and throat infection. And here again, he was talking about heartworm pills, etc. It's imperative that you do this, okay? Stay with us. We'll be back right after this. Thanks for staying with us, folks. I'm Sam Lesante. You're watching Pet's Best Friend with my good friend, Dr. Anaya Kathio. And folks, you can call the good doctor in Pittston at 655-2412 or in Wilkes-Barre 821-9392. Excuse me, 821-9392 or 90?
90.
I'm sorry. That's 821-9390, folks. For the Wilkes-Barre number. Now, the doctor is showing us some different animals that, he's taking care of. We hope that you could prevent some of this stuff. Now we have an animal with heartworm, right? Okay,
yeah.
So let's see what we got here.
Sam, look at these animals. By looking at it, you wouldn't see that anything is wrong with them.
Yes, but, a beautiful little animal.
It looks very good, very healthy, very alert, and everything like that one, but it has a big problem. And I will take you to the microscope, and I will show you what's happening there. And I would do this by obtaining a drop of blood from this dog. And I'm looking under the microscope. Look in the dead center. There's a hair-like thing that is moving around, and that is a filaria. It's called a microfilaria, and there are like thousands and thousands of them in the blood. And they are coming from the adult worm that lives in the heart of a dog, and actually they are coming from that one. And soon the heart, the blood flow will be blocked, and this dog will be showing the signs of exhaustion, and soon this dog would have a exercise intolerance, and that is a very classical one when you see that the animal has affected with the heartworm. But at this time, since that was a preventative measure, we just took a blood sample and looked and to see that this dog was carrying worms to. Well, now
I see the dog, and the dog looks perfectly healthy.
Yeah.
So how did they know? How did they know to bring the dog to you? What was the doctor? What was the dog doing?
Routinely during the summer seasons, it is very common for a veterinarian for us to draw a sample to see if this dog is carrying heartworm or not. If he does not carry the heartworm, we put him on the preventative medication, which is a 1 pill once a month, so it does not develop. Because there are mosquitoes, if you see there are mosquitoes in nearby, it's likely that there are certain mosquito can pass on heartworm to the dog. So it's a preventive measure, just like ticks. If you see the ticks, you can assume that these ticks might be carrying a Lyme's disease, which can be transmitted to the dog. So that is one of the routine procedure that we do every year for the dogs.
So, but did this person come in for a routine checkup, or was it that
no, routine checkup?
Oh, and that's how you picked it up.
Yeah,
so here again, if she didn't bring in a routine checkup, God knows.
Exactly.
So the dog wasn't lethargic. That she says, my dog's not acting funny. It was a routine checkup.
Routine checkup.
Right.
Yeah.
Now we have, before we go, folks, we have a kitten here with an ear, nose, and throat infection, and here it is right here.
Look at this kitten. Was rescued by a very gentle lady from Hazleton area. I brought it down to my office in Wilkes-Barre, and we wanted to make this little kitten healthy. Some people, you know, they are not irresponsible breeders. They let their cats breed outside, and this is one of the victim of that.
Wow.
Victim of that one. And a very nice lady picked it up and brought it over. Now,
wow.
after we give it the treatment
wow.
and you know, taking care of it, you can see these homely looking kitten like me can be you know, be
wow.
a very good pet at home. So as long as we figure out, you know, what
there's the before picture. Thanks, Andy, for putting that. There's the before picture, folks, and
you can see literally, you can see blind, you cannot even see.
Yeah.
And but with the treatment, and if the owner gives the medication on time, and you know, we put him on the medication, and the things we can fix and make people happy.
And you're going to see how this cat turned out. I mean, it's just that's what it looked like before.
Exactly.
Oh my God! It's very this. Could you imagine the pain that little cat is in?
And also, if you have a closer look at it, how adorable!
Oh my gosh, beautiful little kitten!
How beautiful!
Isn't that great?
These animals are.
Now, is there something here again that was there something that happened because of neglect, or was it something, you know?
See, these people, if you do not provide vaccination to your animals, and the animals do not have the good immunity, and if they are bred, their offspring is very weak. They do not have the immunity, then they are exposed to viral infection, bacterial infection, and if you do not treat them in wild, usually they die. But there are kind people in Hazleton area, Luzerne County area. They bring these animals down and put the money from their own pocket, even though they are born outside. But they can give them a home and shelter, and I think that's a great thing. And
going back to, again, you know, the best thing, just like we do with our human bodies, we go to the doctor at least once a year to get a physical exam and blood work and the whole thing. Same thing with a pet. You got to bring them to the veterinarians. You know, bring them to your office so you could do it an inspection or whatever and find out these things. Correct?
Yeah, the animal age faster than human beings do. So take your animal every 6 months for the health checkup to veterinarian. As I said, you know, that dog, especially with the heartworms, you know, dog with the Lyme's disease in the initial stages, you will not see the sign. If things are caught in the initial stages, they can be fixed, and you can prolong the life of your animal.
So if I bring my dog to you, you would know, anyone, you would know, or your cat or whatever pet, you would know from initial exam whether you do need blood work or whether you don't. Not all the time do you do blood work. I mean, it all depends on what you see when you're doing your examination. Am I correct in saying that?
Yeah, like there are certain blood work we routinely do it, whether or not animal is sick. For example, heartworm test or Lyme's disease test or leukemia test in cats, AIDS test in cats, feline infectious peritonitis test. We routinely do that before we vaccinated them. And there are certain tests if we if we suspect that the animal might be having a problem with the liver, kidney, sugar, or something else, then we do the test.
Well, Dr. Kathio, I always learn something when I see you, good friend. It's always nice seeing you too.
Nice seeing you. Thank you very much.
The grandchild and the daughter and everyone?
Children are doing good, everybody. Thank you for asking.
That's good. Well, you keep up the good work, you know, particularly what you're doing internationally for our country and the good people in Pakistan. Folks, Dr. Inaya Kathio, you get him at 655-2412, 821-9390. Go to his website, kathio.com, to learn more about your, taking care of your pet. But folks, I know you all love your pets. Take care of them. Get them to a veterinarian. If you need to talk to a good doctor, you have his phone number. Kathio.com. And remember, our website, you can watch any of these shows 24/7, including Pet's Best Friend at ssptv.com. And we appreciate very much the sponsorship of the shows. We'll see you next time.